If I'm being honest, I'm not even sure that I believe this is a real story because of how ridiculous this sounds. Hey guys, welcome back to the Dr. Cliff AuD vlog. This is vlog number 320, and today I want to talk to you guys about a post that I saw on social media about an individual who is too afraid to go back in and see their hearing care professional. But before I do me a huge favor, click the like button, really helps out the channel. And if you're not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. So you guys know that I talk a lot about best practice audiologic care on this channel, but I also talk a lot about person-centered care. And the person-centered care side of things is really that relationship that you establish with your hearing care professional, making sure that all of your wants, needs, and values are adhered to when they're administering hearing treatment. But I want to share a quick little post here. In fact, it's not a quick little post, it's a rather long post, but I'll try to get through it as quickly as I possibly can for you, because this individual is so afraid of their hearing care professional that they don't want to go back in to see that professional in order for them to solve a problem for this individual. So let me just go ahead and read it here for you. So it says, "So I got my first ever hearing aids yesterday, the Rexton Reach Plus, and they felt awesome in Costco and at home all night. But today there was a whooshing sound coming from the left one. I kept trying to push it in at different angles and take it out and put it back in and turn it off and turn it on, but nothing I did got rid of the whooshing sound. Does anyone have any idea of what the problem might be and how to fix it? I'm scared of the hearing aid guy at Costco because he was mad at me when I went for my first appointment because the woman on the phone said I could join Costco after my appointment, which I thought was weird, and the guy got really mad about the fact that I wasn't a member already. The point of that story is just to say I'm scared of him, so I don't want to have to see him before my follow-up appointment in 2 weeks. I don't want people to get sidetracked on this part of my post. I really just wondered if there's something that I don't know about the whooshing sound and what I could do to fix it." So yeah, I don't know how you can't focus on the part where you're afraid of your hearing care professional. That is definitely an elephant in the room with this particular post. Now that whooshing sound could be anything. It could be the way that the hearing aids program. It could literally be your air conditioner is on the fritz. It could be that you've had a change in your hearing in your left ear. It could be that you have a malfunctioning device in your left ear. It could be a variety of things. And honestly, this individual is just going to have to go back in and see that hearing care professional to try to solve the problem for that. But this brings up a bigger topic here, which is that relationship that you have with your hearing care professional. So, you know, we talk about this thing in the medical world anyway, of bedside manner, right? And you think of it in the context of a really good surgeon, right? I mean, you're willing to go to the best surgeon in the world, even if they are the biggest dick in the world, right? But why? Because they're potentially going to save your life with some surgical procedure that only they can do, and they can do at a high level. And if you have to sit through them like berating you or being rude to you or whatever the case may be, you just grit your teeth and bear it, because you know what? You're only going to have to see them this one time. You're going to be sedated for the procedure itself. You don't really have to make small talk with this individual ever. And to be honest, you're probably only going to see that surgeon for minutes out of your entire life. Unless something goes wrong with the procedure, then you have to go back in for revision and interview and stuff like that with that surgeon. But again, if you're going to a really good surgeon, chances are you're not going to have to interact with them a whole lot, so they can be as shitty as they want to be to you and it doesn't matter. But it is a totally different world when it comes to professional hearing care. You're going to have to spend a significant amount of time with your hearing care professional in order for them to successfully treat your hearing loss. Now, there are some clinics where you go in, you get fit in 15 minutes, you're out the door, and they say, don't come back until you need your next set of hearing aids. Whether that is what this individual is all about, I don't know. At least they had her pre-scheduled for a 2-week follow-up appointment where he can take a look at the programming of her hearing aids. But I'll say this, if it comes down to a surgeon who's going to save your life, by all means, deal with them being a jerk. When it comes to your hearing care professional, you had better make sure that you're working with a hearing care professional that you actually like to work with. So this goes above and beyond the level of care that they're providing you, so whether or not they're following best practices. And yes, I do believe that a hearing care professional should be following best practices with you, but that is only half of what they should be doing. The other half is making sure that you're actually comfortable going there, because you have to interact with them so frequently. At least you should be interacting with them so frequently. I just recently recorded a video talking about provider satisfaction rates, and what I mean by this is the amount of satisfaction that individuals with hearing loss have in their hearing care professional. And those provider satisfaction rates have been declining over the course of the past 10 years, unfortunately. What this means is that even if individuals are having successful treatment outcomes with their hearing aids, they just don't like their providers as much. And yes, there's a variety of different reasons that can influence how you perceive your provider, but I can tell you this, if this individual was given a survey for the amount of satisfaction they had in their hearing care professional, they're gonna rate that professional a 0. Now, I'm not really sure what the requirement is in terms of your membership when it comes to getting hearing aids at Costco. I don't know if you have to have the membership before they even let you in. I don't know if you have to get the membership after you purchase the hearing aids, but at the end of the day, I kind of have to say that this individual, there's blame to be put all the way around. First and foremost, there's definitely blame on the hearing care professional who got mad at this individual for not having a Costco membership. I mean, this individual is probably like, hey, I don't know what to do. Like, you tell me what to do. If I have someone from Costco telling me I don't need a membership to get hearing aids, then I'm going to do what they tell me to do and not get a membership until after I purchase the devices. If the provider is presented with this type of situation and that's not a good thing, well then kindly tell the patient, nope, sorry, you've got to get your membership first, and then I'm more than happy to treat you with your hearing aids. On the other hand, there is blame to go to this individual here. You cannot go to a hearing care professional who you are scared to go to. If you're scared of your hearing care professional, you have the wrong hearing care professional. What do you think's going to happen when something else happens that's out of your control and this provider blows up on you again? Now, some of you out there might be thinking, well, Cliff, it doesn't really mean that this individual blew up. Well, I'm just telling you what this patient is likely thinking. They're so scared of this person that they don't want to call because they're having a problem. They'd rather go 2 weeks and try to find a solution on social media to solve this problem. So clearly, no matter how the provider came across to this individual, the individual perceived it as being threatening. I truly wish this individual the best of luck. Maybe they can request a different provider at that Costco location. Maybe they can travel to a different Costco location. If they choose to continue going to that original provider, they should be bringing up, hey, listen, you made me feel uncomfortable when we ran through that whole, membership issue that I had. I truly apologize for me not understanding your guidelines here, but I'd like to put it behind us and move forward. That's potentially a way that she could smooth things over with the provider and have the provider be okay with it as well. But if I'm being honest, the provider probably sees so many patients in a given day, he probably doesn't even remember this interaction with her. Nevertheless, let's take away a few lessons from this. Number one, you really should be liking the hearing care professional that you're going to, and if they make you feel uncomfortable to the point where you do not want to reach out with them, you really should seek out a different hearing care professional who always makes you feel comfortable. Because at the end of the day, life is too short to work with a hearing care professional that you do not like, especially when you see that hearing care professional so frequently. But I want to know what you think. What would you do in this particular situation? Would you continue to go back to that hearing care professional? Would you return the hearing aids and go elsewhere? Let me know down in the comment section, and I'll see you next week.